Okay, in this video I'll be doing my special test for the knee. I'm going to start with the sweep test. And the sweep test is used to assess minimal joint fusion. A positive result is a small budge or wave on the medial aspect of the knee, just inferior to the patella, within 1 to 2 seconds. All we're doing, get on the knee, this top hand, we're going to move it, see if we get any effusion. Go to the other side and do it bilaterally. Alright, so now I'm ready to perform the ballotable patella test. This is used to assess moderate to severe knee effusion. A positive result is patella bounces or seems to float or bob. All we're doing is, I want you to flex your knee a little bit. I'm just going to press down on the patella. Got a little movement in there. Over here, do it bilaterally. Press down on the patella. So now I'm ready to perform the Lockman's test. The Lockman test is used to assess the integrity of the ACL. A positive result is abnormal anterior translation force to the tibia with, abnormal, positive result is the abnormal anterior translation of the tibia on the femur and pain compared to the uninjured side. So all we're doing, my hand, I'm here. We don't have much movement in there. We'll do it bilaterally. We don't have much movement in there either. Now I'm performing the lateral pivot shift maneuver test. This is used to assess anterior lateral rotor instability and integrity of the posterior lateral capsule. A positive result is if the test is positive and the IT band is intact, the tibia will sublux anteriorly on the femur when positioned in full extension. So this is all I'm doing. In my hand right here. Got one right here applying a valgus force. Then I'm going to go on the other side and do it bilaterally. Relax for me. Start. Now I'm ready to perform the anterior draw test. This is used to assess the integrity of the ACL. A positive result is motion greater than 4 to 6 micrometers or about 0.14 to 0.24 inches or greater than the uninvolved side or the sulfur absent infield. So I'm going to have them flex their knee a little bit. I'm going to sit on that foot to get some stabilization. Put my hands at the back, and I'm going from a posterior to anterior. So there's not much movement in there. Go to the other side, do it bilaterally. Same exact thing. Not much movement there either. So now I'm performing the posterior drawer test. This is used to assess the integrity of the posterior cruciate ligament. A positive result is palpable and visual posterior translation of the tibia on the femur and the sulfur absent infield. And it's basically the same as the anterior drawer test, but I'm going from anterior to posterior this time. So the same exact thing, sit on the foot, get right there. But this time I'm going anterior to posterior. Not much movement in there. Do the same exact thing on the other side. Put your foot up for me. Thank you. Not much movement in this one either. Now I'm performing the posterior sag sign. This is used to assess the integrity of the PCL. A positive result is tibial plateau sits posteriorly on the femur compared to the uninvolved limb. So I got the patient, they're 90 degrees, knee flex. I'm looking for sag up in here. I don't really see any. So then I'm going to take them. I'm going to take their hips to 90 degrees. See if I see any sag in there. Alright, that's it. Okay, so now I'm performing the quadriceps active test. This is used to assess the integrity of the PCL. I'm going to pull those up for me. And the positive result is anterior reduction of the tibia relative to the femur during contraction. So I have her sit, get her to flex her knee to 90 degrees. Put my hand at the distal thigh. I'm going to put my hand right here, and I'm instructing her to slide her foot forward without fully extending the knee. So go ahead and slide your foot forward, but don't extend your knee. Alright. Keep going a little bit more. Alright. Now I'm going to do it bilaterally. So now I'm doing my quadriceps active test on the other side. My hand. Slide your foot forward without extending your knee. Keep going. Alright. That's the quadriceps active test. So now I'm going to perform the valgus stress test. This is used to assess the integrity of the medial collateral ligament. A positive result is laxity and pain consistent with first, second, and third degree sprains. I'm going to take the leg, hang it off a little bit, put it at about 30 degrees. I'm going to put my hand here, put this hand down here, and with this hand down here, I'm going to apply valgus force. So stop it. Now I'm doing the valgus stress test over here. Got a leg hanging off. Put this hand here. And down here, I'm going to apply a valgus stress. On the other side, I said force, but I meant stress. So, I got her. Wait, stop. So I messed up on the last one. Now I'm doing the bilateral part of the valgus stress test. Got my hand here. Got my distal hand down here. What I'm doing is I'm applying a valgus stress, so I'm gonna. Alright. Now I'm performing the various stress tests. This is used to assess the integrity of the lateral collateral ligament. Positive result is laxity and pain. So get my hand here. I'm gonna apply various stress down here. Go do it on the other side. I'm gonna put my hand here. I'm gonna apply very, wait, I need you hanging on the table. My hand here, very stressed down at the bottom. I'm gonna leave it relaxed. Okay. Now I'm doing the Slocum test for anterior lateral rotor instability. This is used to assess the ACL posterior lateral capsule, some other things. A positive result is lateral side of the tibia moves forward more than on the uninvolved knee. So I got my patient sitting supine. I'm going to get her to rotate her medial rotation. So I'm going to turn the foot in for me. I'm going to sit down right here. It's kind of similar to the anterior drawer test, but it's not. And I'm just going to create a force pulling up. But that foot is medially rotated. Go do the same thing on the other side. Rotate the foot in. Alright. So now I'm performing the Slocum test for anterior medial rotor instability. This is used to assess the ACL posterior medial capsule and some other things. A positive result is the medial side of the tibia moves forward more than on the uninvolved knee. So, put your knee up to 90 degrees. You're going to laterally rotate the foot. Sit down and stabilize it. All I'm going to do, apply that force. Do the same thing on the other side. Raise it up. Laterally rotate the foot for me. So now I'm performing the sideline Slocum test. It's used to assess anterior lateral rotor instability. Positive result is palpable and audible reduction of the tibia relative to the femur. Got it laying down right here. I'm just going to apply stress to the knee as I flex it. So, not looking too good. Oops. Alright, now I'm going to do it bilaterally. Now I'm doing the side line sloping test on the other side, doing it bilaterally. Just hips keep moving. I don't know if I'm doing that too right. So now I'm performing the Houston's test. This is used to assess anterior lateral rotor instability. Positive result at 20 to 30 degrees of flexion. The lateral tibia jerks forward as the lateral tibial plateau subluxus. I'm going to start at 90 degrees. And then I'm going to apply a valgus stress, but at the same time I'm going to be doing knee extension where our foot immediately rotated. So I apply my valgus stress right up in here. Got the foot, I'm going to immediately rotate it. And then I'm just going to extend while I got the valgus stress and immediately rotate the foot. I'm going to go back up and I'm going to just extend it again. All right. Now I'm going to do it bilaterally. So now I'm doing the Houston